Hi, so this is a continuation of the video number 1. I just ran out of room. This is still the neurological system assessment, and this is still my patient, Barbie. I am still student nurse Christy. So I don't know where the last video stopped, so we're just going to start fresh with the reflexes. Again, I'm going to test them on bilaterally, both sides, to compare to see how they are left versus right. So let's start with the triceps reflex. You're going to extend the patient's arm out so that you can find the tendon, which is right here. Okay, you're going to grab the patient's arm and just have them relax. Okay, so then you're going to take the reflex hammer and you're going to lightly tap on the tendon, and you will see this response here as you lightly tap. So we are looking for extension of the forearm and slight contraction of the triceps. Again, that's a normal response. And as I just said, we're going to test these bilaterally. So we're going to go to the other side. You're going to ask the patient to extend their arm so that you can feel it and find the tendon. Okay, you're going to grab the patient's arm and have them relax. Okay, then you're going to take your reflex hammer and you're going to lightly tap on that tendon. Boop. And you're going to see that action right there, which again is extension of the forearm and slight contraction of the triceps. Okay, the second tendon that we're going to test today is the biceps reflex. And with this one, you are going to have the patient curl up their arm, like as in a bicep curl. You can find the tendon right here. Okay, then you're going to ask them to just relax their arm on their lap as they're sitting, so that way it's completely relaxed. Again, you're going to take your reflex hammer and you are going to slightly tap on that tendon, and you're going to see this motion right here. And that is going to be contraction of the bicep and flexion of the forearm. Again, we're going to test bilaterally, both sides. Going to ask the patient to go to the left arm, bring their arm into a bicep curl so that you can find that tendon, and then have them relax their arm because they are sitting down. You're going to take your reflex hammer and lightly tap on that tendon. And you're going to be watching for that motion, which is contraction of the bicep and flexion of the forearm. Okay. All right, Barbie. The next reflex that we're going to test is the Brachioradialis. Again, we're going to test both sides. Patient's going to be relaxed on their leg while they're sitting down. You're going to find this bony prominence right here, which is called the radial styloid process. You're going to go 2 to 3 inches above, and that's where you are going to find that tendon. Okay? Again, the patient's arm is going to be relaxed. You're going to take your reflex hammer, and you're going to lightly tap on that tendon. What you're going to want to do, the thumb has to be turned up as well when the patient does it. And what you're going to do is you're going to see the hand supinate and flex in the forearm. So it's going to be like that. Okay. Again, we're going to test both sides. Patient's arm is going to be relaxed. Thumb is going to be turned up. Okay. You're going to find that bony styloid prominence. The radial styloid process. You're going to go 2 to 3 inches above. You're going to take your reflex hammer and you're going to lightly tap on that. And you're going to see the hand is going to supinate and flexion of the forearm. Okay. Okay. All right, Barbie, the fourth reflex we're going to do is the Patella reflex. This can be fun. Okay, so the patient is sitting. Their leg is dangling, so it's not touching the floor. And you are going to find locate the knee, right below the knee. You're going to put your hand right here, and that's going to be where the tendon is. The patient is actually going to look away, so they're not going to be watching you. They're going to look away so that it can be an involuntary reaction. You're going to hit that. You're going to lightly tap the tendon right here, and you're going to see this action right here. And that is going to be the leg extending outward. Again, you're going to test bilaterally. So Barbie, now what we're going to do is do that same exact test over on the left side. Again, I'm going to locate the kneecap, come down inferiorly, and the patient's leg is going to be dangling, not touching the floor, and the patient's going to be relaxed. I'm going to ask Barbie to turn her head and look away. I'm going to lightly tap on that tendon, and I'm going to expect that motion right there. And that is going to be leg extending outward, the lower leg extending outward. Okay, now Barbie, what we're going to do is we're going to test your Achilles tendon reflex, okay? And for this one, I want you to lie on your back. I don't know how in the world I'm going to do this. I want you to lie on your back. Okay. So I want you to lie on your back. I am going to cup your heel with my hand. I'm going to take my other hand and wrap it around. And what I'm going to do is I want you to push down, and I'm going to resist. Oh, no, I'm sorry, that's the next one. We're doing the reflex. Okay, so the patient is sitting. Sorry, we're going to do the Achilles tendon reflex. I got ahead of myself. So this right here on the back of the heel is going to be the reflex. Patient is going to be sitting, legs going to be dangling, not touching the ground. And what we're going to do is lightly tap. Again, the patient's going to look away. We're going to lightly tap on this tendon right here, and we're going to expect the foot to do that motion, which is plantar flexion of the foot downward. Again, we're going to do it bilaterally, so we're going to do it on the other side. And we're going to locate this tendon on the back of the ankle here. Again, I'm going to ask Barbie to turn away. I'm going to lightly tap on this tendon. Okay. And I expect to see plantar flexion. Ooh, you can't see that. Plantar flexion of the foot downward. Okay. The last one, the last reflex we're going to do is the Babinski or the plantar reflex. Now this one is elicited through the skin, so it's not a direct muscle itself that we're testing, and a positive finding is actually abnormal in children greater than 24 months or adults. So kids less than 24 months can have a Babinski and it be normal, but anybody over 24 months and adults are going to be abnormal if they have a positive Babinski. So again, Barbie is going to be laying on her back. Let's see. Okay. Barbie's going to be laying on her back. And then what I am going to do is I am going to take my object and I'm going to draw an upside down J. I can't see very well. I'm going to draw an upside down J. So I'm going to start down here at the base of the heel and go up toward the ball of the foot. And what I expect to see is the toes to curl down. That's a negative or a normal response. So when I do this, that is normal, negative. So if it was a child or somebody less than 24 months and I have a positive Babinski, then when I do this, the toes are going to fan out and open. So again, it's going to be out and the toes are going to fan open. So if that is in an adult and that's a positive Babinski, that could indicate an upper motor neuron disease. Okay. That concludes our reflex test. Now we're going to move on to coordination. We're going to do 3 tests for coordination. Is that okay, Barbie? Alright, so the first one that we're going to do is the finger to nose. And what I want you to do, Barbie, is take your right hand and make a pointer finger. And then what I want you to do is you're going to touch your nose, and then you're going to touch my finger of my hand. I'm going to keep moving my finger around, and I just want you to follow it, and you go back to your nose each time. And I am just going to move close and far away, and make sure that she can go back to her finger and to her nose and my finger each time. All right, Barbie, the next test that we're going to do is a heel to shin test. Again, this is testing for coordination. While she is still sitting down, while she is sitting down for this one, I want her to take her right leg. I am going to hold her left leg, and I want her to take her right leg up to her knee, and then move it down to her shin. Up, down, up, down. And we're going to do that multiple times, and just keep doing it and make sure that Barbie can do that, and she can do that no problem. Then we're going to test the other side. So I am going to hold the left leg. I'm going to hold the patient's right leg. Now I'm going to ask Barbie to use her left leg up to her knee and down to her shin. Knee, shin, multiple times. There we go. Okay. All right, the last test that we're going to do for coordination, Barbie, is called the Romberg Test. This checks proprioception, which is where you are in space without the help of vision. Don't worry, I'm going to be here the whole entire time in case you get unsteady or you feel like you're going to fall. I will be right here, so you don't have to worry about that. So what I want you to do, Barbie, is stand with your feet together and your arms outstretched. And then I want you to close your eyes. And the whole time she's doing that, I'm going to be standing here with my arms near her waist, but not touching her in space. I'm standing to the side like this, just in case she gets unsteady or decides that she is unstable and falls. Then I will be there to provide assistance. A positive Romberg is when the patient becomes unsteady and or they fall. That's abnormal. A negative Romberg is what you would want, where the patient can stand there, eyes closed, and they don't sway or fall or become unsteady. If they do have a positive Romberg, that's going to indicate poor joint position sense. All right. So now we are going to move on to our motor testing. We're going to do 2 of these. So the first one that I want you to do, Barbie, is grip strength. I want you to place your 2 fingers in the palm of my hand, and what I want you to do is squeeze my fingers. Okay, so do that a couple times, and then we're going to do the opposite hand, and then I want you again to squeeze, and all I'm doing is checking for the same strength left to right. Okay, and then we're going to test for dorsiflexion of the foot, which is the one that I did earlier out of whack. Okay, so we're going to have the patient lay down. Okay. I am going to grab the underside of the foot and put my hand on the top of the foot, and I am going to ask Barbie to resist me pushing down. Okay, so you resist, and then I'm going to switch my hand to the other side, and I'm going to ask her to resist me pulling up, and that is going to test dorsiflexion and plantar flexion, and again, we're going to do it bilaterally. So then we're going to move to the left. I'm going to support on the bottom, place my hand on the top, and ask her to resist me pushing down. Okay, that's going to test dorsiflexion, and then I'm going to put my hand on the bottom, and I'm going to ask her to push down and resist me, and that's going to test plantar flexion. Again, I just want to test them left to right to see if there is a difference or a weakness, one side versus the other. Okay, so now we're going to move into the sensory test. Sharp, dull. I'm almost out of time on this video because I'm at 14 minutes, so I'm going to pause here and resume for video 3. 1 second, please.